Thank you for taking the time to watch my presentation. I completed my practicum at Parkwood Place and focused on promoting healthy aging for their residents. So here's an overview of what I'll be covering, but in light of the 7-minute time limit, I am just going to dive right into the content here. So Parkwood Place Rivera is a retirement facility located in Victoria, British Columbia, and their mission and mandate express that through a strategic focus on growth, innovation, and leadership, Rivera aims to improve the aging experience by celebrating the ageless spirit of older adults. My practicum within their recreation department helped me refine my skills in health promotion, program planning, and evaluation. During my experience, I focused on exploring the need for evidence-based health promotion programming, creating an updated recreation schedule, and program evaluation tools for the organization. The main health promotion areas that I focused my time on were cultural diversity awareness, healthy sexuality, reducing social isolation, intergenerational programming, and improving health literacy and health advocacy. These topics are ones that have sparked my interest in the last few years, and I wanted to include options that would be both new and educational for the residents. Through my program design, I drew on principles of social justice by taking opportunities to educate residents about both cultural and sexual diversity, and by offering a storytelling group to encourage sharing their own life experiences as well. In terms of health equity, I created health initiatives that realize the importance of eliminating health disparities among disadvantaged populations from an informative angle. The disadvantaged population groups of focus were Indigenous peoples and those identifying as LGBTQ+. The Public Health Agency of Canada in 2016 explains that an age-friendly community recognizes seniors' diverse range of skills and abilities, promotes social activities, and provides outdoor areas that are accessible. I promoted an age-friendly community by developing new program options that promote social activities in an accessible way. In an effort to foster positive psychology for the residents, I aim to promote community values such as altruism, civic-mindedness, and tolerance. I also plan to have guest speakers come in and educate on topics that it could expand the residents' knowledge of diverse population groups. When approaching the PHSP core value of partnerships with people and populations served, I aim to increase community engagement in recreation programs. Intergenerational programs are reported as one type of social activity that may promote active aging among older adults. I therefore proposed partnering with other age groups and local nonprofit organizations as a part of a gardening project. The on-site outdoor gardening project opened up a variety of options in terms of who could come assist residents with the planting and harvesting. Donating the food grown to those in need was also presented as a possible outcome of this project. My university teachings in this program are what guided my practice. When approaching community development and capacity building, I began by assessing community readiness for change. I addressed variation in physical and cognitive ability levels of residents, created program surveys that used a large font size, simple terminology, and made sure that programs are accessible for those using assistive devices. I also created a pamphlet that outlined topics for guest speakers to address, and the final page of this pamphlet includes a survey to gauge interest levels in the proposed topics prior to programs being implemented. Another thing I considered was the capacity of programs to create social bonds. Social bonds have been shown to increase integration and attachment to families, communities, and society. Creating programs that bring residents and the community together will hopefully increase social bonds and meanwhile reduce social isolation. For my program planning, I evaluated stakeholder and community engagement by obtaining supervisor feedback about which programs would be suitable. I carried out academic research on areas of health promotion for older adults. Informal resident feedback was received on program options during a monthly recreation meeting, and their feedback was considered. For example, the outdoor garden beds were planned to be built to accommodate wheelchairs and other assistive devices, which residents were in full support of. Throughout my practicum, I was encouraged to think outside the box when brainstorming new program ideas. Critical and creative thinking involved taking risks, such as approaching sensitive topics. For example, with the discussion topics on safe sex health promotion and social acceptance of diversity. When presented with the challenges of coronavirus and no longer being on site, I recorded audio to a presentation on Indigenous traditional healing, which will be shared with the residents virtually. I included cultural safety in the program planning by increasing community relations and cultural competency. I reached out to Indigenous-led organizations for guest speaker referrals in an effort to practice culturally competent care. The Truth and Reconciliation Commission of Canada's Call to Action Legacy 2 calls upon those who can effect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices. Although I was not positioned in a frontline healthcare role, the presentation I created on Indigenous traditional healing practices ties in with this call to action by acknowledging the value of Indigenous ways of being. Some of the highlights of this practicum include connecting individually with the residents, the flexibility I had in approaches to program design, the creativity I was encouraged to express, and one thing I'm really proud of is generating excitement among my supervisor and the residents about expanding their knowledge on Indigenous ways of being. About midway through my practicum, my supervisor decided to make April, May, and June Indigenous Peoples Awareness Months, which was a pretty exciting moment for me. Here's a couple examples of tools that I created for the Recreation Department. And finally, I would like to take a moment to thank my practicum supervisor at Parkwood Place for her support and positivity, Natalie Franzen for your consistent guidance, all my UVic instructors and the Department of PHSP, the Global Child Program of Research team, my classmates for sharing their knowledge, and last but not least, my friends and family. I definitely couldn't have done this without you. Thank you.